So in that last video, we talked about the basic anatomy of the gut, and we related that to functions of nutrient absorption, digestion, as well as some immunological functions. But the gut is pretty complex. There's a lot of stuff to it. And what I want to do now is, in the next several videos, is break down the functions of the gut into the general important stuff, which is what we'll talk about now. And then a couple of other more specific things. In fact, we'll layer on a little bit more information of things that we've talked about previously. So we're giving some depth to the breadth of the information that we've already talked about. So in terms of general things that determine gut health, there are many different things that go into a healthy gut. But when we really analyze not only what's published in the medical research, but what we see in clinical practice on a day-to-day, week-to-week, and year-to-year basis, we can kind of localize those down into what I might call the most common culprits or the usual suspects. And this is kind of a good approach in any type of investigative endeavor, is you start with the most obvious things first. And if you find your answers there, then that may remove the need to go look for more obscure or less common things. Now, when I go through these things, and I'll add a couple of more kind of other variables that we add into this, just because I give you this list doesn't mean it's the sum total. I'm just focusing in on where we find most of our answers. So this is about the three main things that determine gut health. The first thing is your brain, and this goes back to the brain-gut axis, right? Without strong input from your brain loses gut motility, so you reduce your bowel movements. You reduce enzyme production, including hydrochloric acid, so you get some degree of maldigestion, as well as some immunological compromise from losing, if you lose hydrochloric acid status, your ability to sterilize your food. We lose blood flow to the gut, which means that we can't maintain the health of the lining, the actual cells that make up the lining of the gut, and this promotes things like gastric atrophy, or more commonly, we see things like leaky gut. And when we don't have that brain-gut axis input, then we lose control of compartmentalizing the small intestine, meaning what's in the large intestine goes up into the small intestine. And this is where we get infection in the small intestine. And, if you remember back when we did the overview of the brain-gut axis, most of the bacteria in your gut should be way down the line at the end of your large intestine. But if the valves that keep the small intestine separate from the large, that allow food to pass southward from the small intestine to the large and prevent it from going back up into the small intestine, if that valve doesn't shut off properly, then we get bacteria that can migrate up into the small intestine, causing an infection. In other words, your small intestine should be relatively sterile, but when the brain doesn't work for whatever reason, then you lose control of the valves, you lose compartmentalization, you get bacterial migration, and then you get inoculation of things in the small intestine that shouldn't be there. And this is, just to kind of shorten the conversation, this is what we call small intestinal bacterial overgrowth, or SIBO, which, to be honest, is a very, very complicated situation. And this video and this program is not really geared towards that specifically, even though everything that you're going to learn here is applicable to SIBO. SIBO is just a much more clinically complicated problem. So how is it that your brain can go wrong? Well, we divide those into three main categories. One is, you could have someone who has some kind of developmental delay. And so if I'm in a doctor-only seminar and we're talking about developmental delays, I might ask the class or the doctors that are in attendance, how many of you work with kids in the autistic spectrum? And a bunch of people put up their hand. And then I'll ask them, like, in your clients, how many of your autistic kids or kids with attention deficit disorder, etc., how many of them have healthy guts? And nobody puts up their hand, because when the brain doesn't develop properly, and there are different mechanisms that go into that, then you lose that brain-gut axis, and pretty much every single kid in the autistic spectrum and related disorders has a bad brain-gut axis, and if all you do is treat the gut, you're going to be treating the gut all the time because you're not affecting the brain. So category number one of how your brain can go bad is poor development. The other category would be head injury. In fact, we have in animal studies, we have evidence that in experimental models of head injury and concussion, we can pick up the earliest evidence of leaky gut within 3 hours of the injury. Think about that. If you smack your melon and you've got a concussion, within 3 hours, the lining of your intestines starts to break down. That's pretty profound. And so if you are someone who has had multiple concussions, and it doesn't mean you have to have blacked out or lost consciousness, but if you've had a serious concussion where you did black out, the longer you blacked out for, the worse the concussion is. But even if you've not blacked out, but you hit your head several times, and each time there's kind of like a progressive elevation of the problem, you can lose that output. In fact, one of the first things, in fact, that in kind of like a acute care settings, if someone comes in and they've had a head injury and they have to be in the hospital for a time, one of the first things that they put them on is a proton pump inhibitor, because they know that there is a probability that with head injury, these people are going to develop stomach ulcers. Now, the treatment is, in my opinion, not the correct thing, because they're just trying to suppress acid so it doesn't irritate an ulcerated gut. But at least they understand the physiology. You need a healthy brain that's not injured for your gut to work well. And when you lose your brain output because you've hit your head and you have a traumatic brain injury of some kind, of some degree, then your gut doesn't work well, and you're probably going to get leaky gut, and you might even get a big old hole in your stomach that we call an ulcer. And then the third part of how your brain can go bad is, actually, let me separate this into two different ones. The next thing is neurodegeneration, which we typically see in our elderly population. And obviously, we all age. People don't often think, we can look at somebody and go, you're older, right? We see the change in their skin texture, their facial features, their posture, their ability to move. These are the external obvious signs of aging. What we don't often think about is that inside things are aging as well. So you have an older gut, you have an older pancreas, you have an older heart, you have an older brain. And generally with an older brain, we have neurodegeneration, which is essentially loss of neuronal mass. You have fewer brain cells when you're 70 than you had when you were 30, 40, and 50. And in fact, the highest number of brain cells you have in your entire life is within the first few months that you're born. And from that point on, we're constantly losing nerve cells or brain cells. But because we are experiencing life and we have learning and new experiences and exercise and all these different stimulatory inputs, we compensate for losing neuronal mass or losing brain cells by increasing what's called plasticity, or the interconnectivity between the cells that are remaining. And so what we know is that basically life is a constant balancing act where we're offsetting loss of brain cells with plasticity, loss of brain cells by interconnectivity and improved function. And if you, as you age, can balance that, and you're always doing new things and learning new things and having new experiences, you can lose a lot of brain cells yet still maintain functionality. Your cognitive capacity can be great, your memory and recall, your emotionality and emotional control, as well as your brain gut axis. But unfortunately, with standard American diets and lifestyles, most people aren't doing the things that keep their brain healthy through their 60s, 70s, 80s, and 90s. And so we see degeneration. And as the brain degenerates, not only do we start forgetting things, not only do we start maybe changing our personality, but we lose the brain gut axis. And so we see the consequences of that in the elderly. We see increased incidences of leaky gut, stomach acid goes down, and so on and so on and so on. And then the fourth thing that we're going to add in there is metabolic disorders. And what I mean by that is, because your brain is the most metabolically sensitive system that we have, if you have general changes and imbalances in your overall metabolism, I'm talking about things like chronic stress chemistry, systemic inflammation, metabolic diseases like insulin resistance or metabolic syndrome or prediabetes or diabetes, all of these things can have a tremendous impact on the brain. We can even throw thyroid disorders, which we'll talk about here in a moment, as well as reproductive hormone disorders. As a general rule, and it is more complicated than this, men need to have a strong androgen or male hormone type dominance pattern to their hormone profile. Women need a more estrogen progesterone dominant for their brain to be working well and healthy. And of course, as we get older, we tend to lose those things. So the first main thing that really goes into a healthy gut is having a healthy brain. And I hope I've established that several times already. So let's talk about thyroid. Now, all hormones are important, to be honest. In fact, one of the extra variables is to have general hormone balance. But we have to single out the thyroid for a couple of different reasons. Probably the most important one is that the thyroid is kind of considered the linchpin of the hormonal system. And we might be able to argue back and forth how important estrogen is to women, testosterone is to men, or in the impact of insulin, the impact of cortisol and stress hormones, and any number of dozen other hormones that we haven't even named. But the bottom line is your thyroid hormone sufficiency controls your overall metabolic rate. And, just to try to link these things together, when you have thyroid hormone insufficiency, we accelerate rates of neurodegeneration over time. So bad thyroid equals bad brain. When we have thyroid hormone insufficiency, we tend to be more systemically inflamed, which can affect everything, including your brain, as well as including thyroid systems. But ultimately, at the end of the day, thyroid hormones, and just to kind of cone it down into the gut itself and things that we've already talked about, is that without thyroid hormone sufficiency, you're not going to get optimal stomach acid levels. You're not going to get optimal bile production from your liver and your gallbladder. And if we look at biopsy studies of ulcerated and permeable or leaky gut tissue, and we don't find all of these things in a single study, but if you look at all of the studies that are published on thyroid hormones and things like leaky gut and gastric ulcers, what we find across multiple studies is thyroid hormone deficiency. We also see deficiencies in estrogen, progesterone, and testosterone. And so the thyroid being kind of the linchpin or the kingpin, the cornerstone, if you will, of the entire hormonal system is very, very, very important for gut health. Now, how do you know if you have a thyroid issue? Well, if you're on thyroid medications, then you've already been diagnosed with it. Maybe you have symptoms and you haven't been diagnosed yet. And that, symptoms, and obviously these symptoms can come from other problems, but when we see a bunch of these together, then we start thinking thyroid hormones and we do thyroid lab work to determine if that is in fact the case. But typical classic thyroid symptoms would be cold hands and cold feet, generally cold intolerant, hair loss, you lose the outer third of your eyebrow, you need more sleep to function, you gain weight even on, say, low-calorie diets. You typically have lack of motivation, sometimes depression. Brain fog is very common as well. And, and constipation, that would kind of round it out. There's a couple of others, but those are the core symptoms we usually find in the population of people who have thyroid issues. And so you can have the classic symptoms, but not yet been diagnosed. Maybe you've already been diagnosed and you still have unresolved symptoms that might imply that your thyroid system is not optimized. Just because you go on thyroid hormones, just because you might have a normal TSH, does not guarantee that you have an optimized thyroid hormone system. And it's about more than just your TSH level. It's about more than just the gland. It's about how the whole system works from brain to thyroid to cell and back again. So that's the second main thing that determines gut health. The third thing is the local gut environment, like what's going on inside the gut. So far, we've talked about the most common outside influences. But, if your gut is inflamed because you're eating foods that you're reacting to, very common thing, not to harp on gluten sensitivity, but it's going to come up a lot in this discussion throughout this course. But a lot of people who are gluten sensitive, when I ask them on my intake forms, like if I'm dealing with a one-on-one consulting client, I have a question that says, are you gluten-free or are you mostly gluten-free? And you might be surprised how many people tell me right away, like, I know that I'm sensitive to gluten. And when they characterize their diet, they say that they're mostly gluten-free instead of being gluten-free. And that's a problem because you're kind of playing with fire. And for most people who are gluten sensitive, a little bit of gluten exposure periodically just keeps their gut and their systemic system inflamed on an ongoing basis. And so eating foods that you're reacting to, whether you are or not, is a different issue. Or having gut infections or having a leaky gut All of these things change the gut kind of from the inside out, right? The brain and the thyroid and some other things change the gut from the outside in. But we're talking now about what's going on inside the gut. And so invariably, when we're dealing with our individual coaching clients, we want to do some kind of assessment. We might want to do a food sensitivity panel. We don't always do it, and there's kind of a set of rules that I follow that determine whether or not we do or we do not. But more often than not, we're going to want to do a good quality stool test. And later in this, not in this module, but in a later module, we're going to talk about stool testing and what are good tests and what are not, because there's a lot of junk out there, but there are a handful of labs that are, in my opinion, doing it right. So we're going to want to look at a stool test, and depending on your presentation and your symptomatology, we might want to look at doing a leaky gut test. And again, there's the good, the bad, and the ugly. There's really, in essence, one lab that's doing it right, and that's the one that we tend to recommend. And so what we've done so far is looked at the main things that determine gut health. Two of them are the outside in, that's the brain and your thyroid, and one is inside out, that's what's happening within the gut itself. But that doesn't mean that there aren't other things that could go wrong. Let's say that your brain is pretty good, your thyroid is optimized, and you're not eating foods you're reacting to, and you don't have an infected leaky gut. Well, you can still have problems if you have a blood sugar control issue. Usually on the high blood sugar side, but we can't rule out problems on the low blood sugar side. But very quickly, having a hyperglycemic state, having a high blood sugar problem, basically means that you're systemically inflamed and your body might be producing things called glycated end products that eventually will lead to things like leaky gut. And that's a scale and a spectrum. It doesn't mean it will happen, but we have to consider it, right? If I have someone who comes in, again, if I'm working with someone on a one-on-one basis, and they come in and, we've looked at the brain, we've looked at the thyroid, and maybe those things are okay, but they're a pre-diabetic. If I don't fix that, I'm not going to fix their gut. Specifically, I'm not going to fix their leaky gut, because that's a huge influence over that. And we might say the same thing about stress chemistry. And I'm just going to relate this again to the leaky gut variable. In kind of like an interesting twist of design, we need a certain amount of cortisol to regenerate intestinal tissue for the repair process. But too much cortisol that we get from stressors or uncontrollable stressors breaks it down. So on one hand, we need it. We need a certain amount. But if we get too much, then we start to promote a leaky gut. And then there's the hormone balance. And so I mentioned earlier about the thyroid studies with leaky gut, that if we sample gut tissue in leaky gut and ulcer conditions, we see low thyroid hormones across the board. But we also see, as I said, low estrogen, progesterone, and testosterone. Doesn't mean they're all there, but on a case-by-case basis, that's where we start to look. Could there be other things we add to the list? Yes, but we want to focus on the main things that we see in practice all the time and then relay that to you so you can start thinking about, okay, what might be my problems and how do I get those assessed? And, on that sense, I'm not obviously, giving you answers to the questions, but at least I can point you in the direction of the questions that need answers. Like, is your brain healthy? Are you an adult who struggled through developmental delays? Have you ever injured your head? Have you had concussions, even if you've not lost consciousness? But if you have lost consciousness, that's a big deal. If you've had multiple concussions, even though you never lost consciousness with either one, that is a big deal because there's a cumulative effect in terms of neuroinflammation and the potential for degeneration over time. Are you in the older category and showing signs of early neurodegeneration? Or do you have metabolic issues like systemic inflammation, chronic stress chemistry, or things like prediabetes or diabetes that increase the risk that your brain is not going to work well? If so, then you're going to lose your brain gut axis to some degree. Is your thyroid optimized? It doesn't matter if you are on thyroid hormones and have a normal TSH. The story is so much more complex than that. I would venture to say, in fact, let me tell you this, that a past president of the American Thyroid Association is quoted in the literature as saying, we don't understand why this happens, but half of our clients on thyroid medications with a normal TSH still have unresolved thyroid symptoms, and we don't know what to do for them. So this is a huge problem. In fact, it's a big part of my one-on-one consulting practice is working with people who have thyroid issues, particularly autoimmune hypothyroidism called Hashimoto's hypothyroidism. Is your gut infected? Do you have bacteria, fungi, parasites, or viruses? Are these infections forming what's called biofilm? And this is going to be a topic of discussion on its own. But the short story is biofilm is basically a protective coating that infections use in your gut to hide from your immune system, to prevent medications from affecting them so that they can persist and survive. Is your gut inflamed from any source? Are you eating food you're reacting to, or are you inflamed because you're infected or you have a leaky gut or some other reason? Are you eating food you're allergic or sensitive to? Do you have a gut-based disease like celiac, Crohn's, or ulcerative colitis? Those always involve an inflammatory process and change how the gut behaves internally. Have you been diagnosed with ulcers? Do you have a leaky gut? And what about things like blood sugar, stress, and hormone imbalances? These are the questions that need to be answered if you're going to understand the general challenges that you're going to have to start working towards resolving. And in fact, I believe very strongly, and this is what we teach in our seminars to doctors, is that if you don't have the right investigative mind from the beginning, you're not going to understand what problems need to be fixed, and you're going to get kind of shuttled off into protocol-based or protocols that are based on symptomatology. And this is one thing that's very common in the world of nutritional medicine, is that quite often docs, for either because they just don't have the clinical experience or knowledge, or from a business standpoint, they're trying to streamline operations to make it easy to see a lot of people and generate a lot of income. They make protocols for everything. And without understanding individual physiology, like what is your individual and unique challenge, the only thing you can base your protocols on are either a diagnostic category or your symptoms. And so practitioners tend to have a gut protocol that is a one-size-fits-all, and that's not what you and I are heading towards. What I'm doing is I'm teaching you the thought process. I'm teaching you the variables and the challenges that you have to have an understanding for, so that when you look at what your options are, you can pick and choose what's relevant to you. Now, it would be very easy for me to give you a generic one-size-fits-all, everyone do it this way, but that's not the way I practice, and it's certainly not the way I would want to lead you into trying to do your own self-care. So let's leave it there. I'll catch you on the next lesson.